Hello, today's question was a question about bladder stones, more specifically cystine stones. So, kind of different names for stones. Some of them are kind of the same thing. Cystine, struvite, calcium oxalate, they're all kind of the same stone. There are some minor differences. I'm generally a broad spectrum doctor. I don't get into all the nitty gritty because generally the treatment is pretty much the same. So it doesn't really make a difference as long as it's one of those three. There are some different stones called urates. Those are very different and the treatment is different, but that's a very, very small percentage of patient stones and it's very breed specific. Most of those are bulldogs and Dalmatians. And even most of the bulldogs that I've operated on, most of them are still cystine or struvite stones. So, good question. But they wanted a little more information on, I'm going to just simplify it as struvite stones, cystine stones, relatively synonymous. Basically, what you want to look for as the client is trouble going to the bathroom, strained urea, blood in the urine, difficulty urinating, and some of those things. Now, cats, that's a lot more touchy, and that's a different topic about obstructed toms. I believe we have a video on that. Those get a lot more life-threatening a lot quicker. Typically, our stones, it can cause obstructions. It's common in both males and females. It can get more life-threatening in our males. The reality, because they have a smaller ureter, therefore, or urethra, and therefore they can pass. Smaller stones can get stuck, and that can lead to actual emergencies. Depending on when we catch them varies a little bit. Every doctor has their own opinion on how to go about it. Generally, by the time I'm identifying them or clients bring them in, we take x-rays, we see stones. Most of those are a surgical problem for us because there's so many or they're so large the patient can't pass them. You can try and medically dissolve them with prescription diets. Once again, depending on the size, every doctor has their own preference. Most of ours, by the time they get small enough to pass, you might as well have just done the surgery and kind of gone that route. The other thing I get a little concerned with when you have a male and you're trying to medically dissolve the stone, say it's this big, it can't fit through the ureter because it's too big, but if you make it smaller, theoretically it can get small enough where it can pass partially through the ureter. Generally they'll get stuck or get stuck somewhere called the os penis, and then you have an emergency surgery and things can get a lot more complicated. And just depends when we get to them and how big and some other variables. So once again, cystine stones are very similar to struvite stones. Calcium oxalate's pretty similar, a little bit different, but for all intents and purposes, thus far the treatment's pretty much the same and the way you manage them are pretty similar. So that's kind of how I would go about it. Some females have a recessed vulva and that will predispose them to more UTIs. UTIs are retrograde infections, basically bacteria from the back end, outside environment, working their way in through the penis or vagina can cause a UTI, urinary tract infection. And that can create an itis for bacteria to take hold and then snowball effect, develop stones, and lead to sequential problems. So thanks again, guys. Appreciate all the love and support. Thanks again. Keep submitting those questions and we'll do the best we can.